Hello everybody and welcome to the Thursday edition of Video Clips. And before I start the message today, quick reminder, the Diet and Lifestyle Intervention course starts in 3 weeks, so it is time to get registered if you want to learn from Dr. McDougall, Dr. Goldhammer, Dr. Neil Barnard, me, Dr. Esselstyn, and Dr. Polevsky about vaccines and about mental health and all these other issues. If you're a practitioner or you're planning to be one, or if you just love the adventure of learning from the best, this program is for you. It runs 15 weeks. We only do it once a year. So if you don't do it in June, you have to wait until 2014 for another chance. All right, so I'm going to pick up where I left off on Tuesday with David Goldhill's book. Goldhill talks about the risks of overdiagnosis, and he mentions Gilbert Welch's book. I've covered both of his books in video clips and voicemail newsletter. He wrote Overdiagnosed and Should I Be Tested for Cancer, both excellent books. He's a medical doctor in New England. And he quotes Welch talking about normalcy is the most typically measured result in a population, but atypical doesn't mean not healthy. And as Welch points out in his books, the more we test, the more we find, and are we really better off knowing? A lot of our success has been treating people who weren't going to turn into patients or sick people anyway. High cholesterol is not heart disease, and high blood sugar isn't diabetes. He quotes a British Medical Journal article that stated, and I think this is so sad, but it is true, medicine's much-hailed ability to help the sick is fast being challenged by its propensity to harm the healthy. Our current system doesn't consider the size of the risk and reward when determining whether or not to do something, another phenomenon that makes island life different. How is it that the healthiest generation of people in history requires so much care? Well, Medicare has provided an incentive for providers to find needs and fill them. An example, 20%, this will blow your mind, of people 95 years of age and older have surgery in the last year of their lives. This is horrendous when considering that seniors are so vulnerable to overtreatment. They recover more slowly from procedures, they have more side effects, and they certainly have less time to enjoy any benefits that might come from the procedures. Now, most people think that Medicare is a great system because it's cheaper to run. 97 cents out of every dollar is paid out in claims. But this isn't a good thing. Spending no money on administration means that nobody is looking at whether or not tests are needed, drugs, procedures, if any of this is useless. Medicare, as I mentioned on Tuesday, is just a bottomless pit with no budgetary constraints. Now, just to show how much this is true, the Dartmouth Atlas of Healthcare compares the cost of treatments in various areas of the country. And then there are huge variations. Medicare spends 3 times more in Miami than in Honolulu, for example. Why? Well, the most common reason is more doctors and more hospital beds. The more of these there are, the more money spent. Areas with excess capacity use it by performing more care. And if you have the bad fortune to live in an area with lots of doctors, you are at risk of overtreatment. Medicare will pay for anything, including diagnostic tests like PSA testing for terminally ill men and mammograms for terminally ill women. I mean, it just blows your mind. Now, how does Medicare affect patients? Well, hospitals are so dangerous, according to Goldhill's data, that a senior has a greater chance of dying in a hospital than a soldier has from dying in combat. And it lacks the administrative capacity to do anything about it. Goldhill says that when his family was informed that his father was dying, it would only be a few hours, he was absolutely blown away when an orderly visited his room to draw blood for a test. Why does somebody who's going to die in a few hours need to have a blood test? Even when Medicare makes an attempt to cut costs, it backfires. I talked about that with chemotherapy. Another example, in 1983, Ronald Reagan was responsible for sweeping Medicare reforms, and one of the main issues concerned the number of days that patients were allowed to stay in the hospital, declined by 40%. No cost savings, however, because the cost per day for the room went from $300 to $1,800, and it gets worse. Prior to reform, hospitals used to bill Medicare $4,700 on average per discharge. And by 2010, the discharge bill had grown to $40,152. No savings there. The wrong types of attempt to control costs create higher costs due to the perverse incentives I keep coming back to. Cost plus billing sounds good, but if you tell hospitals you'll pay for the cost of drugs plus a percentage in fees, you've incentivized the hospital to use more expensive drugs. Hospitals even order larger doses than needed because they can pocket a percentage of the waste. The problem is that central price fixing, while it sounds wonderful, doesn't work. And Goldhill uses a great example, coffee. What influences the price of Starbucks coffee? Well, many things. The beans, water, labor, cups, grinding machines, brewing machines, counter space, rent. But then there are other issues: competition, location, economy, season. You're going to sell more iced drinks at a higher price in the summer, for example. So think about how impossible it would be to set up a central coffee management organization that would set prices for all vendors with some type of central pricing mechanism. We're led to believe that we can benefit from stable prices, but we don't. We'd be better off letting the market determine prices. Fixed prices don't respond to changing conditions. And this issue that the surrogates are paying the bill and the consumer has no idea or connection to it is a main problem in trying to cut costs. Now, speaking of which, and I'll finish with this today, Goldhill's mother received a bill from the hospital after his father's death for $635,695.75. Goldhill says he could have rented a hotel room in the most expensive hotel in town for 5 weeks, filled it with the most expensive equipment, hired round-the-clock nursing care and a daily 1-hour doctor visit for only $150,000, which would have left $500,000 to pay for drugs, oxygen, and blood. But it doesn't matter because Medicare is going to pay anyway. And the market value, and I think this is interesting that he said this, the market value of the services that killed his father would have been zero on the mainland, but not so on the island. The market value of killing your father on the island, $635,695.75. Amazing, right? All right, well, that's it for today, and I will be back to you on Thursday. As usual, feel free to pass this on to anybody who you think might enjoy watching it, and talk to you next week.